going to ask you a simple question. How many of you have ever taken medication of any kind? Okay, super. Now, how many of you have ever thought about how these medications are actually working in our bodies? Different question, but yeah? 10 years ago, I have learned how these medications are working. I studied pharmacy at the university, and I was introduced to the fascinating word of pharmacology. I've learned how these medications are working, interacting with ourselves, and actually how these medications are changing the behavior and the function of every single cell of our body. You need to understand that every single cell in our body has receptors that are specific and different. These receptors are working as locks. On the other hand, the medications have molecules, and these molecules are working as keys to these locks. So when the medication binds to the receptor, the specific receptor, it creates a chain of reaction. It activates it. And this will lead into a modification of the cell function. Let me break it down. Let's take, for example, beta blockers in cardiology. When you take a beta blocker, it will bind into specific receptors in your heart cell, the beta receptors. This will block the signal that is responsible for the heart to beat faster. So it will lower the heart rate, but it will also reduce the blood pressure. Another great example, which is insulin, for diabetes patients. So, diabetes patients rather don't produce enough insulin, or they produce it, but their cells don't respond well to it. What happens is that when we inject insulin in our body, this insulin will bind into the specific receptors, the muscle cells, but also the fat cells. This will lead into the absorption of the glucose that we have in the blood that will help these cells to function, give energy, but it will also lead to reduce the glucose level in our blood. If we don't do that for diabetes patients, this will lead into a dangerous level of glucose in their blood. There are so many other examples, like chemotherapy, that are targeting the cancerous cells. Honestly, every time I talk about that, I find this fascinating. I really love that. I love science, but I also love technology, and that was the case 10 years ago. So I had to choose between my two lovers, and I went to something not really common for a pharmacist at that time, the world of health technology and digital. And what I found there really amazed me, because when I talk about pharmacology as like the modification of our cells and our body's behavior with medication, these can happen with technology as well. Year after year, technology had a great impact on the patient pathway, and the therapies as we know them today are not anymore the traditional therapies. There is a new emerging technology called digital therapy. So these therapies are actually softwares, mobile apps, everything you can find that can integrate AI or not, by the way, but can really have an impact on our bodies the same way the medication would do. They can support the medication, but they can also mirror what the medication are doing. Let me break it down. I know it's complicated to understand. So let's take the painkillers, for example. So let's take a patient with chronic pain. If we take a painkiller, what happens is that these painkillers are going to bind to specific receptors in our brain and also the spinal cord that are responsible for the pain signal. When we block the signal, we reduce the pain, or, we can block it. It's like reducing the volume of a loudspeaker. Now, let's go to the technology. Imagine, now there are headsets, like virtual reality headsets with specific softwares that are developed, studied under clinical trial, and have proven that they can reduce the chronic pain by 40%. 30% is exactly the same way than the painkillers are doing. How? It's actually just by tricking our brain, shifting our attention to the pain and giving a different environment with the virtual reality, so we can reduce pain intensity by 40% with technology. Yes. There are other great examples, and I love one of them, which is in mental health. In mental health, they have developed technologies that are actually able to reduce anxiety and depression by 40% by using cognitive therapy with mobile apps. Only that, really? Antidepressants are doing the same, but they're impacting our neurotransmitters. So imagine 40% with medication, 40% with technology. And you can use the technology wherever you want. We also reduce the side effects. I'm not telling you that we're replacing medication, but we're just supporting them through this technology. There are so many examples that I can give you. And there is another one when I come back to diabetes. In diabetes, it's impressive how technologies are actually working and impacting the patients with diabetes. There are solutions, like the glucose monitors, that are helping the patients nowadays to reduce the risk of complication by 60%. Can you imagine what is 60% for a patient with diabetes? It's a game changer. So technologies are really impacting our life. I'm not talking about gadgets anymore, right? I'm not talking about technologies that are just developed. I'm talking about technologies that have been developed, studied under clinical trials, registered into authorities, healthcare authorities, but also sometimes reimbursed and prescribed by our doctors. It's the case nowadays in US, UK, and Germany. Why I'm talking about that? Because as a human being, the most important element for us is our health, right? So, what's the future of medicines for me? The future of medicines really bites into this combination between the traditional medicine, but also these technologies that are changing our life. We don't know it yet because digital therapy is really new in our healthcare world. People don't talk that much about it, but it's actually the future and started to be the present in some countries. It was important for me to talk about these technologies, not only because I'm working on it, but also because I can see the impact they can have on patients. And I can tell you, by using these technologies and trying to buy as much as possible for my father with diabetes, that it can actually work. A simple thing, reminder app. In cardiology, they have proved that using reminder app for hypertension patients was able to improve and delay the complication by 20%. Just a simple reminder app. You can do that, with your phone, simply without downloading anything. So for me, the future of medicines really lies into this combination. And the objective is really, with all of that and the studies that we are doing, is to improve patient outcomes, to better happiness, because the most important element in our life is really our health. Without our health, we will not be able to take care of anyone in our life, and we can be happy. Thank you.